Hi, I'm Joe Thompson. I'm a physician. I'm a parent of two wonderful 20-year-olds, a son, and I'd like to tell you I'm an old Gen Xer, but I'm really a late blooming boomer. And I'm here to tell you today, we are all going to die. At some point in the future, my time and your time on this earth, in our bodies, is going to end. And we want to live well and die fast. Now, as I age, and my colleagues age, and my friends age, I find myself in all sorts of new conversations. Conversations about our kids as they get out of school, as they start their career paths. Conversations about vacations that we've been on now that our kids are out of school and we can go on vacations again. Things that we want to do, places that we want to go. A lot of my friends are very focused daily on the stock market as their retirement investments go up and down, sometimes hourly. It seems like they're constantly paying attention to that. But what's a challenge is some of the conversations are tougher. Some of them are about parents that are aging, parents that have debilitating disease, parents that are now entering the end stage of their life and challenging us on how we are going to manage that. And it's not just my friends. I have strangers and colleagues that come up and ask for help in navigating that most important, most challenging end-of-life issue for their parents. I think probably many of you are having those same conversations. Some of you should be having those conversations, and you're not yet. My brothers, my mother, and I, we lost my dad recently. He was 95. He had 85 great years. He had 10 challenging years, and he had 2 really bad months. And when we got through with that, I stopped to think. I said, what's going to happen with all the baby boomers coming through the pipeline and all of our new Gen Xers coming up? How are we going to manage this? Is there a way that we can do things better? Is there a way that we can change the outcome? And that's when I came back to, we're all going to die. It is mortality. Every one of us is going to contribute an N of 1 to a mortality statistic at some point in time. Now, a century ago, when you were born, you would live about 50 years, and you would probably die of an acute event or an infectious disease, and it would be over quickly. Today, when you're born, we live well past 50. In fact, most of you will live to 80. Some of you will push the century mark, like my father did. But these last decades are not necessarily healthy decades. They're filled with conditions now, like heart disease, diabetes, cancer, arthritis, and yes, dementia. And so we come back to it. We say, these conditions are our morbidities. How do we push those conditions, the morbidity, to the very end of life so that we maximize the time that we have because of extended mortality, but we want to have minimal morbidity? Well, I'm not going to sell you a magic pill or show you where the fountain of youth resides, but I think there are concrete steps that we can take. They start early in life. For our millennials in their 20s and 30s, my kids, they are trying to lay down a new job, maybe start a family, accelerate a career. But this is a critically important time to commit to and start down a healthy, active lifestyle. It's important, most important, for them to wear their seatbelts and wear their helmets. Accidents are the number one disabling causing information for those kids. It's also important for them to start out and to resist becoming a fast food junkie. Put good food into your body because it's such a beautiful machine that you're going to have it last forever. Find physical activities that you can weave together into a fun-filled and active lifestyle. It's important also that you avoid the addictions of nicotine through electronic cigarettes and tobacco and other drugs of abuse, including alcohol. And finally, as you're searching for your partner in life, use safe sexual practices so that you protect yourselves from risks that are in the environment. For the Gen Xers in their 40s and 50s, my brothers, younger brothers, it's important. This is the prime of life. This is when your investment at that point in time is going to dictate how you live the rest of your life. The 2 most important insurance policies you can have are physical activity and your diet. We know that physical activity immediately, 30 to 45 minutes a day, immediately conveys healthy impact on your body. It also conveys long-term health impacts for your memory and other organs in your system. It's important for you to watch the 2 or 3 pounds a year that you may be putting on, because 2 or 3 pounds a year ends up being 20 or 30 pounds over a decade. It's important to cut out the fat fried foods and to avoid the sugar-sweetened beverages. And yes, for my Southern friends, sweet tea is a sugar-sweetened beverage. It's important to get out and be active. Take the stairs, not the elevators, sorry. Park at the edge of the parking lot, not next to the door. It's also important to start using the science that our healthcare system has developed to start screening for cancers like colorectal cancer and breast cancer, to get your hypertension and your cholesterol under control. It's also important to develop your social circles. For too many of us, work is our major social outlet. And when that retirement door closes, our social circles get cut off and we're isolated and we can spin into depression. Finally, it's important to watch for drugs of addiction and bad habits that will cost you your life downstream. As you move into your 60s and 70s and your parents, the boomers that are in our communities now, it's important that you remain active physically, mentally, emotionally. If you're a words person, do crossword puzzles. If you're a numbers person, do Sudoku. Turn off the TV, get up off the couch, go out into the yard, go to the park, find your friends. Build that community of activity that will keep you alive and engaged. It's also time to boost your immune system. Your immunity wanes over time. Through vaccines and immunizations for the flu and for pneumonias, you can actually rob the Grim Reaper of a common reason that people don't see the longevity in their lives. It's also important to safeguard your home, to get rid of rugs like I'm on, to avoid falls. One of the common things that will spin an otherwise healthy elder into the ditch and down a pathway that costs them valuable years that they could spend with their family. Finally, it is important to start having the conversation, the tough conversations about what's coming. At some point, there will be decisions that are important to make that you will want your loved one or yourself to have a major input on. Our healthcare system is amazing. It will help us bridge across things that are reparable, things that we can survive, things that are good for us. But it's also full of technology that can extend our life well beyond that in which we find high quality. It's not good at assessing the quality of life that we have or helping us make the tough decisions of when we don't want the next therapy or the most expensive technology in the intensive care unit. So it's time to have those what-if conversations with a trusted family member or a clinician. What if you had a stroke and you weren't able to recover? What if you had congestive heart failure and could never get out of bed? What if you had an incurable cancer? How would you want to spend the rest of your life? What if your mind was leaving you faster than your body was failing you? How would you want that to end up? These what-if questions are important because most people, when they think about their end, they want a peaceful death, surrounded by family and friends, in a place that is comfortable, usually their home. Unfortunately today, too many times, that death is in a brightly lit intensive care room with bells and whistles and lots of machines and not the family and friends and the peacefulness that people desire. So that's why it's important to do the next step, which is to have a plan. And that plan is very important. It's 3 steps. Sit down and come up with a single-page medical history for yourself or your loved one. Put the history, put the medicines, put it down on one piece of paper so that when an event happens and you present to a clinician that does not know you, it's all in one place and they're not ordering a number of tests that may cause harm or may cause pain that you otherwise don't need. Second step, talk about the end of life that you would like to have. Under what conditions would you like to have things done to you? Under what conditions would you like to refrain from having things done for you? Have that conversation, document it in an advance directive. And then the third step is the most important. Take those 2 documents and do not put it in a safe place. Make copies, put it in the glove compartment of the car, stick it on the refrigerator, give it to your children, give it to your best friend, because you don't know when that event may happen. And that document and that history needs to be present as you go forward. Then go out and enjoy the remaining years of your life. Now, my dad had done that. He'd lost much of his physical capabilities because he didn't exercise in his 40s and 50s. Over the last 10 years, he lost many of his mental capabilities, to where in the last few years, he neither had mobility nor did he have awareness around him. My mom did heroic work in keeping him safe, in keeping him fed, in keeping him happy. He loved to go for car rides. I'm not sure he knew where we were. I'm not sure he knew who was with him. But he loved seeing the world go by and understanding and reliving things that in his mind were still fresh and bright and beautiful. I want to challenge you, as your world goes by, to think about your investments that you're making in your body, your mind, your soul. As you think about what that next car is going to be, as you think about where you're going on vacation, as you think about what your retirement funds are, remember the most important asset you have is your body and yourself. Make good investments, and I hope you'll think about how you want to live well and die fast. Thank you very much.